So the three fundamental components of the need statement are your problem, your population, and your outcome. And these come together in a format that says a way to address the problem in a specific population in order to achieve a desired outcome. So this will get burned into your brain. You might even consider a tattoo over time if you're really committed to the biodesign process, but you need to really internalize these elements of the need statement. Next slide. When it comes to writing need statements, we've got a couple of different tips for you. So first and foremost, it is essential that you remain solution agnostic at this point in the process, right? We are at the identify phase. We are not thinking about solutions. We are becoming experts in the problems, the unmet needs that we're trying to solve. So you don't want need statements that, you know, say things like a way to prevent a stent from clotting, because that assumes that basically a better stent is the solution, right? What we want to think about is something more broad, a way to improve blood flow due to obstruction, you know, on and on and on. Next slide. When you're thinking about your population, you want to think about the fact that not all populations are created equal, right? Any patient presenting with chest pains is very, very different from women over 55 years old with chest pain and a history of myocardial infarction and a CABG procedure, right? So just keep in mind, you want the biggest population you can find, but the larger the pop and the more heterogeneous the population, the more difficult it would be to solve their problem. So you're looking for the sweet spot, a specific enough population that you can do something meaningful for all of them, but that's something that still represents a compelling opportunity. Next slide. Tip 3 here is regarded to, and don't just think about differences in your population based on, you know, age and gender, right? There are multiple elements of diversity here, including aspects of race, socioeconomic background, any number of different factors. So we want to really be thinking expansively about differences in populations as you're thinking about which population to target. Next slide. Tip number 3 relates here to your outcome. Outcomes must be quantifiable and able to be objectively assessed, right? We want to be thinking about things like improved outcome, better safety, reduced costs. One way to think about this is what could you potentially prove in a clinical trial that would be meaningful in terms of getting people to move off the current standard of care. So your outcomes need to be specific and measurable. Next slide, please. You guys also-
and if I can I interject something, Lynn?
Yep, real quick.
Just on those outcomes, they can't be made up at what you think would be good. You actually want them to be based on your need finding exercise, either from the literature or other sources. So it's, you know, sometimes you can set outcomes that are, you know, wouldn't it be nice if this, and it sounds good, but it actually isn't validated with customer data. So make sure it's validated.
Yeah, 100%. Thank you, Josh. And I don't mean to rush you. I'm just trying to get them to their exercise with the fellows. You guys also read about need scoping. Can someone raise their hand and tell me what we mean when we say need scoping? Anyone? Yeah, Rachel, thanks.
Similar to what you said about the population, it's going up to the large enough group to increase the market size, but it would need to have a single mechanism of action so that one solution could solve the problem.
Yeah, thanks. That's awesome. What we want to do is we want to play with the problem, the population, and the outcome by making them broader or more narrow to find kind of, again, that optimal combination that is going to represent the most compelling opportunity. How do we make choices about which problem, which variation of the problem, which variation of the population, and which outcome? What do we use to help us make that decision? We just guess? It's like Mad Libs. Anyone? This is so much better when we can do this in person. Yeah, Josh. Oh shoot, Josh, we're not hearing you. I feel like we're having real audio problems today. Sorry, guys.
Is that better?
Yes, thank you.
Okay. You want to talk to your potential customers and find out kind of what need statements resonate with them.
Yeah, so you're exactly right. What you're using, you're going to make these decisions on your need scoping based on this in-depth need research that you're performing. And your need research is going to involve both primary and secondary research. So hitting the books and then getting out of the building and talking to the relevant stakeholders. So you're not making guesses, you're scoping and exploring different variations of your need statement, and you're using your need research to inform which one represents the most compelling combination. A couple quick tips. You can think about making the problem larger or smaller based on the mechanism of action, as Rachel said. So what's going on with the pathophysiology, here, and do we want to be very specific, night terrors with sleepwalking, or do we want to be very broad, any sleep disorder? What you're doing is you're scoping, as you can see sort of along this tree analogy, to whether you're closer to the trunk or more specific out on one of these limbs. Next slide. Tip 2, you could also scope the problem by thinking about the cycle of care. So maybe you had a particular observation involving treatment, but you'd want to think upstream and downstream of treatment to think about maybe which problem is most compelling to solve. Is there a prevention related problem that might be worthy of addressing, or is it really the big pain point related to treatment? Next slide. Our next tip here is also to think about the largest possible segment of the population that is homogeneous enough to be addressed by a single solution. So we hit on this before. What is our biggest population that we can do something meaningful for with a single solution? And you can see the example here. Next slide. And then in terms of an outcome, we really need to think about the outcome that will be considered most compelling by the key decision maker, right? The decision maker that gates access to treatment or that will gate access to your solution. And you need to choose an outcome that will be meaningful to that person to get them interested in making a different choice about, again, standard of care here. Obviously, things like death are more compelling than provider satisfaction, but each need is a little bit different, and you need to think about what outcome is going to be most compelling to that decision maker in the need area.